Alright guys, so this is our lecture video on chapter 46. Before we begin, go ahead and get out a piece of paper so you can jot down some notes and answer the questions that I'll be asking throughout this lecture video. I will have an assignment where you have to submit the questions that I'm asking in the video. It will be titled Chapter 46 Lecture Discussion. And basically in the discussion, you will just write the answers to the questions that I'm asking. And then you are encouraged to talk to your other classmate and maybe comment on what they said or just share input or whatever you like. Or if you just want to go ahead and just submit your answers and leave it alone, that's fine, because we already have our weekly discussions. But I was just trying to make the lecture answers to the questions and stuff like that more of a discussion, like kind of like what we would have done in class. Make it more of a discussion setting rather than you just submitting your answers to the questions that I'm going to ask. If you have any questions after you submit all the answers to the questions that I'm going to ask in this video, at the bottom you could put in bold or just put question dash and then ask your questions, and I'll respond back into the group discussion. And this will count as a participation grade. So each week whenever I upload a lecture video from now on, a lecture discussion will come with it. Okay, just to make sure everybody's watching the videos and understanding everything, and we'll ask questions in discussion form. That way, if somebody else has the same question, you can see it like in the thread that has been answered, or if you have a different question, like it just helps everybody and keeps us connected. So without further ado, let's get into it. So the terms and things like that's going to be in the book. Go ahead and read over those. You'll also see it again as you read through the chapter. We'll talk about the 3 types of impressions taken in the dental office. We'll talk about the types of trays, and we'll discuss hydrocolloid impression materials and their uses. Okay, I'm sorry, I'm having to record like this because my Zoom is not working, but I don't let anything stop me, so I'm just gonna hold the phone this whole time. All right. So intro. So impressions are taken a lot in the office for various things, whether it be for crown procedure or for dentures. So impression taken is something important that you need to know how to do, and this chapter just tells you a little bit more about it. Okay. So impressions are negative reproduction of dental structures. Okay. Impressions are negative reproduction of dental structures. But when you go and pour it up in stone, like how when we pour up our impressions, that model that you create is then considered a positive reproduction of dental structures. Okay, so my first question for you to go and record and put into the group discussion is, what is considered a positive reproduction of dental structures? And then your answer would be what? When you pour up impressions, pretty much the model you get from that will be your positive reproduction of dental structures. Okay. All right, let me try to press enter now. Okay, so classification of impression. So there's 3 different types of impressions. This is important, guys, especially when we talk more about the crown procedure. I know we talked about it last module, but as you guys know, when you get into the end module, you learn the same checkoffs twice. So we talked a little bit about crown last month. We're going to talk about it again. That way, the more you see it and hear it, the more you're able to remember it. Okay. So I want you to write this down, and this is going to be number 2. Okay. So number 2 is, what are the 3 classifications of impressions, right? And your answer would then be what? Preliminary, final, and occlusal, or the body registration. Okay, so as you know, the preliminary impression is the first impression you take before the doctor does any work to that patient's mouth. A preliminary impression has to be taken, right? That is what you make, that impression is what you'll use to create your temporary crown. Okay, and then once the doctor has prepped the tooth, and in the crown procedure, for instance, after he's made the tooth smaller and you've packed cord, then he's going to then take a final impression. So this is taken after the tooth is prepped. Then you'll take the final impression. And the final impression is the impression that will go out to the lab. Okay, that's the impression they'll use to create whatever you're needing, whatever prosthesis you're needing. And then lastly, you have your occlusal impression, or your bite registration is what you call it, which is just a model of the teeth coming together in occlusion, hence the term occlusal registration. So those are the three types of impression that are taken in dental procedures, mainly the crown procedure. So it'll be preliminary, final, and bite registration, or occlusal if you want to call it occlusal. All right. And then, of course, the doctor will be the one to determine what type of material that you'll use. Every doctor is different. So if you notice, if you're working with more than one doctor in the same office, you'll notice that they may do things a little bit different. That is when you use your assisting skills to remember what each doctor likes and does not like. And so just don't go into the office with kind of a laid back approach. You want to stay on your toes. You want to be paying attention to everything, so you can learn your doctors, and that will make you shine in the office, one, and then it'll make your job a lot easier because you won't have to go back and get this or that. You'll know exactly what it is that they want. So when you go into the office on externship, even though you guys are going to be externs next module, you need to be on your toes, studying the office, studying the people around you, paying attention to how they do things. All that is going to come in handy. How they even speak and talk, in the office. Just, kind of mimic your surroundings. All right, then next you have the preliminary impression. Like I said before, that is going to be the first impression taken. It can be used for the following reasons: for models, provisional coverage guides, which is also for temporary coverage, or aka the temporary crown, orthodontic appliances, pre-treatment and post-treatment records, so they can see like how the patient has improved, just things like that. Okay, and this preliminary impression can be taken by the dentist or the dental assistant. Most likely you'll be taking it, because doctors, if it's something that they truly don't have to do, they won't do it. If it's something that you can do, most likely you'll wind up doing it, believe me. All right, the final impression. Now this impression, my students, this impression is going to be taken by you and the dentist. It will be like a team effort, okay? The doctor will be the one to place the final impression. You just assist him in taking the final impression by loading your tray with the heavy body, while he puts the light body directly onto the tooth. When he's ready to place the tray, you just hand him your tray with heavy body, and he puts it in the mouth and has the patient bite down for like 4 minutes until it sits. All right. And then also you need to write this down. The final impression is going to produce the most accurate reproduction of the teeth and surrounding structures. Okay, that is why it's considered a final impression. You want to get the most accurate impression. It is also why we use heavy body and light body. That's elastomeric material. That material is going to give you the most accurate impression. Okay, so question number 3 is which impression gives the most accurate reproduction of the teeth, and you're going to put the final impression. Okay. All right. And then the final impression can be used for indirect restorations, which is like crowns and bridges. It can also be used for partials and full dentures, as well as implants. All right, next slide. Bite registration. Again, this is the occlusal registration. So it just takes an impression of the relationship between the upper and lower teeth. Okay, it just shows them how you bite or how you occlude. Okay, this also helps when they're creating the crown. Okay, and this is also taken by either the dentist or the Hispanic functions dental assistant, which is you. Most likely you'll also be taking this impression. So mainly the main impression the doctor will take will be the final impression. All the other impressions, just be prepared to take it, because like across the board, most doctors, if they don't have to do it, remember, they won't do it if they don't have to. So the final impression is very important, because they don't want to mess up the lab order. They do have to pay to use the lab, so of course they don't want to send things back and forth. They don't want to inconvenience be like an inconvenience to the patient. So of course they're going to make sure that they're the ones who take that final impression, or they ensure that it's taken right. All right. So impression trays. So of course we have to load these materials into the tray to in order to get the impression. So the impression trays are also very important. Before you take an impression, remember this, guys, for the office. You guys are going out next module. I want you to know this. If you ever have to take an impression, you need to, before you mix up anything, before you start to stir, because you know that impression material sets really quick, you need to put the tray in the mouth and measure it. That needs to be measured. You have to make sure it's a good fit, okay? You have to make sure it's deep enough that it covers all the molar teeth in the back, that it's not too tight on the interior, okay? And the two basic types of impression trays are going to be stock trays and custom trays, okay? Okay, so stock trays, they come in different sizes and styles. Okay, so it's gonna look like this. You have different trays. You have your perforated trays, which would be, hold on, let's find my mouse. You have your perforated trays. You have your stock trays. I'm sorry, not stock trays. Your interior trays. So just this type of tray will only take an impression of the interior part of the mouth. Okay, you have your quadrant trays here. So you have variety there. Okay. So selection of impression trays. So it has to be comfortable to the patient. Can't be too tight. It has to extend beyond the facial surfaces. That means that once you put that tray in, it should not be directly like so tight to where it fits snug over the anterior teeth or the front teeth. You want to make sure they have a little bit of room. It needs room so the impression material can be like formed around the tooth. So if it's too tight, you don't always get a good impression, or you get tearing, and you don't want that. So just make sure that you be mindful of the tray size. Okay. Also remember that it needs to extend on the back area or the molar region 2 to 3 millimeters beyond the last molar seen in that patient's mouth, because everybody doesn't have their third molar or their wisdom tooth. Some people just have their first and second molars back there. So if that's the case, you just make sure that the tray goes a little bit beyond the last molar. Okay, not too much, because you don't want to gag your patient, but it needs to not stop right at the end of the molar. It needs to go a little bit beyond that, so you have room to get a good impression. You also need to make sure the tray is deep enough. Now, if your patient has a full amount of teeth, the tray needs to be at least 2 to 3 millimeters deep. Okay, if your patient is a dentulous or they don't have any teeth, you then can get a tray that's not so deep. All right. Characteristics of impression trays. So you have your quadrant tray. This is important, guys. Write this down. I want you to also, for number 4, list the 3 different types of trays in their description. So you'll put quadrant tray. It covers half the arch. Section tray. It's only used for the interior part of the mouth. So it's not going to cover the third molar and the second molar and all that stuff. It's just going to stop at about a little bit beyond the canine, around that area, because it's only used to get the interior portion of the tray. Then you have your full arch tray, which covers the entire arch. Okay. So characteristics of impression trays continued. Okay. So so this is also important, guys. So if your tray has holes, it's considered to be perforated. Write that down. If your tray has holes, it is considered to be perforated. So that's number 5. So what kind of tray? What is the name of the tray that has holes? Perforated. You don't have to write the question. I just need answers, guys. But I want you to do it in note form. So how about go ahead and write the question as well. That way it's kind of like your notes. It's going to come in handy when you take the test anyway. So let's go ahead and just you could shorthand the note, the description. Like you could put perforated equals tray with holes. You don't have to write like a long thing, okay? It's not like our weekly discussion where we have to put, everything in complete sentences because we're practicing for the office. This is just our lecture discussion, so I want to know that you've taken notes. So basically, you're going to be transferring your notes from this video into the discussion area, and you can also ask questions, and we can all chat as a class. Okay, so this particular discussion doesn't have to be that formal. Okay? Next one. So if the tray is not perforated, so let me explain this first. So when the tray is perforated, it creates a mechanical lock, right? It holds that material in place. But if the tray is smooth, then there's no way to create a mechanical lock. So if you want to lock that material in or keep it in place, you would have to use what's called a tray adhesive, which is a spray that a lot of offices do have. So basically you'll spray the tray, let it dry, then mix your impression material and take the patient's impression. But if that tray doesn't have holes, you most likely won't get a good impression. So you need to spray the tray if you want that material to stay in place for you. Okay, this is very important because you don't want to waste your time. Okay, so number 6, you can put, jot down this. So whenever you use a smooth surface tray or a tray without holes, you need to use a tray adhesive. So in the office, if you happen to go on your first day of externship and they say, hey, can you take a impression? Sure, yeah, I don't mind. Okay, this is all the impression stuff. Go ahead and do it in room 3. They're not going to explain this stuff to you because they expect you to know it, right? So if you have to use a tray without holes, just make sure you ask them like, hey, where's the tray adhesive if you don't see it, okay? And make sure you let that adhesive dry before you go to put it in the patient's mouth.